Hey friends, it's Nurse V here. So, I realized in the last vlog I didn't really give you an update about where exactly am I. So, I recently moved to Oregon to start my new grad residency, and so far I'm in my second week. So, without going too much into detail, let's just jump right into it. Kind of give you an update about what exactly I did this week. So, on Monday, I had a Zoom call with some of my colleagues that I graduated from college, and it was really great to see everyone all together. We're all nurses now, and we're sort of just updating about each other's life, some of the patients that we're working with, COVID 19 patients, non COVID 19 patients, some self care routine, and just kind of, staying in touch. So it's really nice to see all my friends doing really well, and I'm really glad to have them be part of my life and part of my nursing journey as well. On Tuesday, I am currently working in a COVID 19 unit, and it was the first time that I actually had a chance to walk into a patient's room that was a PUI. And so here I was given the chance to actually really practice donning on and doffing off and really focus on being very deliberate and be very careful when it comes down to putting on proper PPE. I was working with two patients at the time, and both of my patients, they had very similar diagnoses. They were both admitted for cardiac issues, and they're waiting for COVID 19 test to be rule out whether they have COVID 19 or not. And there was this one particular patient that really stood out to me. He started off really great. He was alert and oriented times 4, but within 4 hours later, his neural status started to shift really dramatically. His heart rate drops to 40. He became very unresponsive to touch, and at this point, we had to really assess him really strongly to a point where we had to call rapid response team. And I think at this point, everything just kind of toned down, and I was really quite surprised that I was able to use that critical nursing judgment to be able to assess the patient, and then ran over to my charge nurse to tell the nurse what exactly I was seeing. So me and my preceptor, we were in there. We were really kind of making sure that we did everything that we need to do to make sure that this patient was going to get the appropriate care. We called our RT team. They came over. They assessed, anticipating that we're going to do a code blue. Thankfully, this patient was able to be more responsive, and then we end up admitting him to the ICU. Went down to the ICU and kind of give our shift report down there to the ICU nurse to get more appropriate critical care. So I think what this lesson has really taught me is that during these very moments of crisis, I had to really learn to suppress any type of fear, doubt, and emotions in order to really focus at the matters at hand, and then kind of bring that and tackle my resources, in this case the charge nurse, and be able to give my charge nurse a very good report in order to determine what's the next step to do. So pat on the back there, so I was really proud of myself. Okay, so then on Thursday, I ended up floating to a different floor. So I floated over to a medical surgical floor to work with 4 patients. And I think one of the challenges things for me is time management. And it's always been a challenging thing, and it still is. And I think it's going to take a lot of practice and a lot of experiences to start really developing kind of like that nurse 6 to 8 arms, right? Because I had very limited amount of what you call like nurse's arm to be able to do many things all at once. So I was really, really focused on one particular thing, and it's hard to really get that big picture. So here I was, juggling between different types of things, like getting blood sugar for my patients, and working with one patient while working with another patient, and then we get a different order at the same time, and then something else happens on the floor, and I had to like really kind of decide. So I think what really helped for me was creating a brain sheet. All right, so let's talk about brain sheets. And for my non-nurses viewers out there, so if you don't know what a brain sheet are, they're essentially templates that nurses create in order to stay organized when they're giving a shift report to the next nurse. Even during their 12-hour shifts, it's a way to kind of collect data about their patients objectively, when they're doing their full body assessment. What are some critical lab values, some new orders, things of that sort. So during my last semester as a student nurse, I created my own brain sheet, and I even used it during the first week of my residency. So this was my prototype. So I have pretty much the vital information I need about the patient. I have their name, their room number, their age, and then kind of break it down to their head to toe. So I have their neural, I have their respiratory, their cardiac, all the way down to their critical lab values, what things I need to do from this time to this time to this time, The reason why I don't like this is, number one, this is only catered to one patient. On my floor, I work up to 4 patients, right? So you can imagine if I have, my clipboard and I've attached this on here plus 4 other sheets, I'm basically flipping through so many pages. It's taken up a lot of time. And even though this sheet itself is organized, my hands are not organized. And I think that is one of the reasons why I needed to downsize the amount of information when I'm working with multiple patients. If I work in a critical care ICU, then things might be a little bit more different. I would have a little bit more time to kind of really focus on my patient because of the less patient load. So what I've done for my particular unit is that just 2 days ago, I created and customized a brand new brain sheet, which I really like because here I can fit 2 different patients on here. So, and also this is just how my brain works, right? When I'm getting information, it's easy for me to just kind of go up and down. Whereas the other one, it's sort of a hodgepodge mess. Even though I've created this, it's really hard for me to even start, right? My eyes just kind of get overwhelmed by so much information. So for this one, it's really quite simple, right? When I'm given a shift report, I can say, John Smith in room 10, born on April 23rd, 1942. He's a full cold. He's allergic to acetaminophen and some other antibiotics. Diagnosis is he came in for a shortness of breath and some chest pain. He's got a history of, he had a bypass. Physician name is Dr. Wing. CNA is Jane. Recent vital signs are blah, 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 blah. And then, head to toe, alert and oriented ×4. Does he have a tele? Check, right? Another thing about this is that I have these little check boxes, and it's easy for me to just kind of check it off when I'm receiving a report from the night shift nurse. So, does the patient have a tele? Yes, check. Is a patient on an NG or OG? It's on an NG tube. Cool, check. Does the patient has a Foley? Yes, so check. What are some precautions about this patient? Well, he's a COVID-19 patient. Okay, so contact, droplet, airborne, right? Is the patient on a suicide risk? Is there a 1-to-1? Yes, check. Is there fall risk? Yes, because the patient is a 70-year-old man, right? Down to the diets, right? I check for that. If the patient is a diabetic, I check diabetic, and so I can anticipate that I'll be checking their blood sugar 3 times during that 12-hour shift. So morning, breakfast, lunch, and dinner, right? And I'll write it in these boxes. These are some of the lab values that I like to look at for my patient based on my patient's demographic. I'm working with a lot of cardiac patients, right? What type of lines, IV, medicate, what kind of lines are they using, what type of medication, that is very vital for this patient. And then I would do the same for my next patient, right? So if I flip it over here, it's blank, but when I fold it in half, I kind of split this into 2, right? So this is going to be that patient 1, this is going to be for patient 2. For that patient 1, I even split it into another half. So here I would write down also what are some of the vital information about my patient based from the night shift nurse. Here I would write down some of the new orders that the physician has given. Here I would write down some of the things I've done, some of the things I need to do. So it's just a really nice way to stay organized and also kind of have extra free hands so that I'm not fumbling through my clipboard. So it's a lot more productive and a lot more efficient than what I created in the past. And then Friday, which is today, was a little bit of a half day. So I spent half day on the floor and then half day in the library. We are responsible to do these clinical education modules to stay informed about some of the latest evidence-based practice, as well as sort of learning some of the textbooks things we need to learn to work at our floor. So, I was working on topics of things like diabetes, working on pain management, working on stroke. Pretty much it's almost like going back to nursing school for new grads at a residency, but it's a little bit more catered to the hospital policies and learn about the procedures in order to practice safely for a patient. So just got to finish my shift and I'm about to head home. So all in all, the second week went really well. I would say I've learned quite a lot in a short amount of time. I felt much more connected with my coworkers, with my preceptors, with my patients. The unit, the hospital that I'm working at, it was very comforting, very caring, and I think that I completely lucked out to be able to be in a very positive work environment to allow me growth and space to become the nurse that I envision and inspire to be. And so, here I am at home, gonna be celebrating my 3 days off, and I think I'm gonna be spending the weekend just sitting in my hammock, reading a book, and kind of checking in with some of my friends and my families and see how they're doing. So this is all. I hope you are all taking care of yourself. I wish you very well. Stay safe. Thank you for staying at home. For many other people out there, you are the front line, okay? We are not the front line as medical professions. We should be the last line of defense. You guys are the front line. So I just want to say, continue, supporting your community and really stay home and stay informed. And don't inject disinfectant into your lungs, despite of what our presidents say. So this is VM signing off, and I hope you are taking care of yourself. Peace.